Welcome to Showcase Richmond. I'm Amie Carter. Sheltering Arms Institute provides physical rehabilitative care for individuals who have sustained a variety of illnesses and injuries. The organization does this through its inpatient hospital and 8 outpatient centers across Central Virginia. Sheltering Arms Institute is ranked the top physical rehab provider in Virginia by U.S. News and World Report. And joining me today to talk about spinal cord injury awareness and prevention are physical therapists Blaire Chandler and Drew Weisbeck. Great to have you both on Showcase.
Thank you for having us.
It's great to be here.
So September is Spinal Cord Injury Awareness Month. What exactly is a spinal cord injury and what typically causes it?
So a spinal cord injury results from any damage to the spinal cord itself. That can be from trauma, neurodegenerative conditions or diseases. Spinal cord injuries affect people's ability to function, to move, to feel, and even basic bodily functions like bowel and bladder management or blood pressure management. The leading cause of traumatic spinal cord injuries is motor vehicle accidents, followed closely by falls, acts of violence, and sporting or recreational injuries. Examples of non-traumatic spinal cord injuries would include things like compression from tumors or loss of blood supply to the spinal cord itself, or severe degeneration of the spine.
Wow. And what are the different levels of spinal cord injury and how does the level impact someone's function?
Yeah, so the injury itself depends where the damage occurs in the spinal cord. So for example, an injury to the cervical level or the neck level might result in loss of function in the arms and hands as well as the trunk and legs, whereas injuries lower down in the thoracic or lumbar spine might only affect the trunk and or legs.
Wow. And how many spinal cord injuries occur each year in the U.S.?
According to the National Institutes of Health, there are 18,000 traumatic spinal cord injuries every year, but this does not account for the non-traumatic spinal cord injuries that Drew mentioned earlier.
Wow. And why is physical rehab so important following a spinal cord injury?
So a spinal cord injury can result in loss of mobility, inability for one to care for themselves, or even simpler tasks like communicating, swallowing, or even breathing. And after an injury, people are going to have to relearn how to do these tasks, and research suggests that early intensive rehabilitation provides people with the best opportunity for recovery.
Wow, and we're showing some video of you guys doing what you do best, the physical therapy. Talk about how long it typically takes to recover from a spinal cord injury.
So each spinal cord injury is unique, and some spinal injuries are lifelong, especially ones that are more complete, like Drew mentioned earlier. However, we do see that most patients make the most recovery in the first year after their injury, but can continue to make improvements for years to come after their initial injury.
And what would you say sets spinal cord injury rehab apart at Sheltering Arms Institute?
So we combine the latest research with the newest technology, things like robotics and exoskeletons, to really optimize recovery. Sheltering Arms is a model systems hospital for spinal cord injury, one of the only ones in the nation. And what that means is that we cooperate with the other model systems hospitals to share research and implement the most up-to-date techniques for recovery. We believe in a team approach to rehab, so that includes the patient, the patient's family, and of course all the skilled providers that work with them.
And in addition to the skilled providers that we also have many specialists at Sheltering Arms Institute, including a walking recovery specialist, an arm and hand recovery specialist, and an in-house wheelchair clinic, which is really important to get spinal cord injury patients and customized seating. We also know it's really important for these patients to interact with people who have the lived experience of spinal cord injury. So we work with a lot of community partners, including United Spinal Association and Sportable, to set our patients up with peer mentors while they're in the hospital and get to even participate in adaptive sports while they're in the hospital to really start to show them what they can do.
Wow.
And it's this holistic approach to care, along with our research-driven clinical teams, that really help to set us apart from other SCI rehab across the country.
That is awesome. So much good information. Thank you all so much for joining me on Showcase Richmond. Sheltering Arms Institute has 8 locations around Central Virginia, so you can reach out and connect by visiting shelteringarmsinstitute.com, or you can call the number right there on your screen, 804-877-4000.